Welcome back, everybody. If you are interested to know about good oral hygiene and maybe some helpful tips and suggestions on how to keep a clean mouth, this is the segment that you want to pay close attention to. We're visiting today with Dr. Stan and Dr. Carol Montee. They are with Montee Montee Dental in the Green Hills area of Nashville. We're so glad to have you all on.
Yeah,
Thanks for being here.
Yeah,
a lot of people want to know, when do you start taking good care of your teeth?
Really, you want to start from birth. Parents want to start, from the time their child's born. A good guideline is to bring your child to the dentist by the time they're about age 1, which is usually about 6 months after the first tooth erupts. It's important to do that early. Gets the child used to going to the dentist. It's good for the parents as far as education if they have any questions, and also helps to identify if there's any growth or development issues or baby bottle decay, things of that nature.
Okay, and you're basically, parents always do this, but they're cleaning their children's teeth for them, obviously. They obviously will give them the toothbrush after a while. At a certain age, they start cleaning themselves. But at what age do you finally say, okay, you're old enough, you need to be doing this on your own and doing it well?
I'd say about 3 years old.
Oh, okay.
Yeah, is when you should have your child to start brushing their teeth.
Okay.
You certainly want to do that before 3, but it's great for them to also watch you brush your teeth, watch you floss, so that they learn how to take care of their own mouth.
And flossing as well. I mean, I know 3 is kind of young, but is it when they lose their first tooth, or should you start flossing right away as well?
Ideally, it would be great to have a kid start flossing, but I've yet to see a kid that flosses,
or do it well.
Right.
So I guess when they get a little bit older is when they to learn to do that.
Yes.
Because it's a little tricky even as an adult to try to get into your teeth and make sure that you're getting them clean.
Right.
How long should you spend brushing your teeth? And likewise for your children, and even as yourself. I mean, how long are you standing in front of the mirror and making sure that you're doing a good job?
Right. A good guideline is 2 minutes, and actually most people brush for under a minute. So we're in a little bit too much of a hurry.
Sure.
So 2 minutes is a good guideline, and for children, they have timers that can be a fun tool to use just to make sure your child's brushing long enough. And we do always recommend to parents to make sure to check their children's teeth after they brush. There are even some types of mouthwashes for children that will stain plaque, and so the child sees where they need to brush better.
Wow.
And those can be really helpful.
That's really interesting, especially for young kids who are trying to focus on what areas to reach and what to get.
Right.
Let's talk about specific foods that are no-nos for both kids and adults. Obviously, there's some kind of hard candies and things like that that you want to steer clear of, or gums, or I'm not really sure, but tell everybody what they should be eating and what they should avoid.
Well, you definitely want to eat healthy foods. You want to have a balanced diet. Potato chips are bad. Chocolate's actually good. It's not too bad for you. Yeah. It's because the chocolate will melt and it'll rinse off your teeth, whereas sticky foods like potato chips will stick to your teeth, and that causes decay.
Do you tell folks when they do eat those types of foods, brush right after? Is that even something that you think people might consider doing, or?
That would definitely help. Or if you're going to, like for instance, with like a sweet beverage, like a sweet tea or a soda, I'll always recommend, if you can't brush, to drink some water afterwards, or if you could chew a piece of sugarless gum, that would help to stimulate your saliva. It kind of naturally washes your teeth.
That's something that I'm glad you brought up, because the production of saliva is the most helpful thing, I understand, as far as keeping a clean mouth. Explain that, if you don't mind.
So saliva production, there are some things that can affect it negatively, especially for older adults that are on a lot of different medications that can cause dry mouth. There's thousands of medications out there that can do that, and so that makes you more susceptible to decay when you have a drier mouth.
Yeah. And we have different proteins in our saliva that protect us from the various types of bacteria. We also have minerals that help to remineralize the teeth when you do have what we call an acid challenge. So if you're going to drink an energy drink, for instance, it's very acidic, high in sugar, within the first 5 minutes the bacteria are going to love that sugar, they're going to eat that sugar, and they're going to produce a lot of acid. So in that instance, you want to wait about a half hour before you brush your teeth, because you could actually do more damage if you brushed right after drinking those types of drinks. And then your saliva will help, like I said, has the minerals and has fluoride, and it'll help strengthen your teeth.
Okay, and I'm just going to refer to you as Dr. Carol and Dr. Stan, because I don't want to say Dr. Montee.
That's what our patients call us.
So Dr. Carol, you had mentioned, drinking water and maybe having a piece of sugarless gum. when you are having certain types of foods that you know that might either stain or kind of cover the tooth, can you have that splash of water to help no matter what you've just taken in to kind of alleviate any problems that might come up?
Sure, that'd be very helpful. Yeah.
Okay, so that's just a little tip or a trick that someone could do right
Absolutely.
afterwards.
Yeah.
Let's talk about mouth pain, because I know there's all sorts of different reasons that someone might be able to have pain. Name a couple of those, whether it be cavity or gum related, or what usually gives us pain in our mouth.
The thing that we see most often in our practice when people come in, they have mouth pain, it's due to a dead tooth. You know, you've heard of people needing a root canal. What happens is the nerve dies inside, and they'll come in with just an intense throbbing pain. They may be sensitive to something cold. When they drink a cold drink, that cold will last a long time. They may have an abscess in their mouth, so that's something we typically see.
Okay, and I guess for kids, it's probably another tooth pushing up, because I know my
Yes,
children have
exactly.
complained about that, and usually that's what it is,
Right.
is when one tooth is still there, the baby tooth, but you've got another one coming up. So I guess it could be related to that as well.
Absolutely.
For the younger
Yeah,
ones.
sure.
Also, let's talk about switching out toothbrushes, because that's something that people don't consider a whole lot, and just in terms of when do I get rid of the one that was issued to me by my dentist, how long can I use it, if I'm sick, do I throw it out, or what would you all say?
Well, usually a good guideline is every 3 to 4 months, but
Okay.
if you see that the bristles are starting to bend or kind of fray, then it's time to change your toothbrush. If the bristles are fraying very early, then that could mean that you're brushing too hard, and that's something that we see pretty commonly.
Okay.
The other issue would be that if you are sick, that it is a good idea to change out your toothbrush, because the bacteria can live on your toothbrush and cause reinfection. So.
For folks who use, and I'm sorry, Dr. Stan, go ahead. I know
No,
you,
go ahead.
did you want to add
I think
anything?
I'm going to answer your next question.
I was just going to say, a lot of folks have turned to, electric toothbrushes,
Right.
because let's face it, I mean, when they were coming out with all sorts of neat gadgets, everyone wants one of those. What is better, a standard toothbrush, or are some of those electric ones pretty good?
If you look at the research, actually, the electric toothbrushes are by far better than the old manual toothbrushes that we grew up with.
Okay.
Both of the electric toothbrushes on the major brands that are on the market right now are effective. Personally, in our practice, we recommend the electric toothbrush with the round toothbrush head on it and not the square.
Okay.
If you go into your dental office and you have your cleaning and you look at what the hygienist is using, she's using a round little brush to clean your teeth. And the reason for that is it really cleans all surfaces of the teeth. It does a nice job of getting in between the teeth, and you can actually get it behind your far back molars back there, where it's very difficult to do that with a square head. So,
And I was also going to mention electric toothbrushes are really good for children, or even like older adults who maybe their manual dexterity isn't very good.
Oh, that's a
So
great
they're really good options.
Okay. Also talk about gum disease, if you don't mind. That'll be the last thing that we cover. Explain that, please.
Well, gum disease is basically an inflammation in the gums, and it basically deteriorates the supporting bone around our teeth. So it can be very serious, and in the most severe cases, it causes tooth loss. So there's some important factors as far as keeping your teeth not just brushed, but flossed. If you're not flossing, that's when you're going to be prone to gum disease. And there's also some risk factors like smoking or diabetes that also can lead to gum disease. So it's important to keep those risk factors under control. And I'm trying to think if there's anything you have to add to that.
no, that's about it. That's great. Yeah.
Well, you both have terrific smiles. And
Thank you.
I think you always want to go to a dentist who has that,
That's right.
obviously. And twice a year is what we should probably go
Yes,
and see your dentist and
absolutely,
check in to make sure. Okay.
Yeah, that's
Well,
right.
Dr. Carol, Dr. Stan Montee, pleasure to meet you. Thank you all
was
for
a pleasure,
sharing
yeah.
such great
Thank you for
information
having
that
us.
we went today.
Thank you. We
Yeah,
appreciate it.
yeah.